We are so excited for you along your journey to health and wellness. I'm so glad that you came out today to join us on the interesting topic of it is not the foods that's making you obese, it is the missing nutrients. A little bit about myself. I am a licensed, board-certified functional healthcare practitioner. I'm a doctor of functional medicine and nutrition. I have 12 years of clinical experience in both areas of acute and chronic inflammation. The reason why we chose to invite our community out today is to show you a healthy way, but yet satiating way, to ditch the weight permanently. I know a lot of you are wondering, what is functional healthcare? Raise your hand if you have any common knowledge on what functional healthcare is. Okay, in functional healthcare, we get to the root, okay, whereas conventional medicine, we cover up the symptoms, but in functional medicine, we get to the root, so we are the root cause solution to many of your chief complaints and concerns. We have an illustration here. This is a tree, okay? If you look at this tree has deep roots. So as we look at the human anatomy, we have a variation of different symptoms such as weight gain, asthma, allergies, thyroid, memory loss, infections, depression. So these roots, whether it be genetics, poor digestion, trauma, lack of sleep, nutritional deficiencies, stress, it helps us figure out what is causing the symptom. It is not the foods, contrary to your popular belief, it is the missing nutrients. Why is weight loss so important? It is important for a variation of reasons. It's our health and overall well-being, disease prevention, those of you who like to play competitive sports, our looks and self-esteem, healthy libido and sex drive, as well as our clothes fitting properly. Us ladies, I know you can contest to that. You want everything to be shapely. There are health risks associated with being overweight, as you know. In the United States, we are the most obese country. Some of the health risks that are associated with being overweight will lead to diabetes, whether it be type 2, arthritis, heart disease, high blood cholesterol, depression, anxiety, certain cancers, high blood pressure, sleep disruption, gut issues, and leaky gut dysbiosis. I know we may know a lot about weight loss, but weight loss is not created equally. We're going to teach you today the how. What is the how? How are we going to get there? How are we going to lose the weight yet permanently? Here at Aurora Functional Health, we found a system for our patients that works well, and what we do here is we optimize and correct our digestion, okay? A lot of the weight gain we see today, it comes from nutritional deficiencies and poor digestion. We would like to integrate a nutrition regimen, okay? A healthy diet, not just any diet, the diet that's customizable to you and your blood type and your genetic. We like to consume 9 to 12 servings of fruits and vegetables. Consuming 9 to 12 servings of fruits and vegetables not only help reduce and eliminate inflammation, it also helps get a reduction in weight loss. We like to manage our stress, okay? Whether you like to be yoga, book reading, exercise, things like that, we highly encourage stress management. Eating fresh produce. I know a lot of you guys like to shop, so just shopping along the perimeter of the aisle, you'll find yourself in a great space to help you reduce weight. Just shopping along the perimeter of the produce aisle. Now, I would like some audience participation here. I know a lot of people have different ways to help you lose weight, but what I found is reducing GMO grain, and conventional dairy will help you get there faster. So I would like for you all to say, lose the wheat, lose the weight. When
Lose the wheat, lose the weight.
no grain, no pain.
No grain, no pain.
So when we lose the wheat, we lose the weight. When we lose the grain, we have no pain. That is the root cause of over 900 different degenerative illnesses. Now, not trying to be too scientific and overwhelm you, but there is a scientific factor as to how we lose weight. Not all weight loss is healthy, so we want to make sure that you're doing things healthily and you don't have nutritional deficiencies or long-term health issues. So we use certain testing measurements, and this is what we're testing for in our test. We look at the Krebs cycle. Do anyone know what a Krebs cycle is, by the way? A Krebs cycle is our energy production system. This is where we learn how to process carbohydrates, fats, and proteins. So there's a test that we can use on you guys to see what nutrients is missing to help burn those carbs, okay? You need adequate amounts of carbs, protein, and fat to reduce weight. Now, our testing measurements will let us know the exact deficiencies that are present. So what we'll do is we'll see through the test measurement, and then we'll resolve that nutritional deficiency, and in turn, this will optimize your digestion. Okay, for example, in this illustration, we need vitamin E, alpha-lipoic acid, vitamin B1, vitamin B2, calcium, vitamin B5, and zinc. We need all these nutrients to help you burn those carbs, okay? And in turn, this helps improve your cellular function and your metabolism. We will also test for the methylation cycle. Now, the methylation cycle, have anyone ever heard of that? Okay, that is your body's detoxification system, your cellular health, and how your genes are regulated. Okay, what this means is, this chest measurement will look at your neurotransmitters in your brain, see if you're getting enough sleep, if you have enough serotonin and tryptophan to lose weight. A lot of people don't know that needs to be healthy to lose weight. We also need to look at the folate cycle as well as the methionine cycle. We look at the homocysteine cycles. One of the beneficiaries you'll see in the testing is looking at your blood type. Do you know how many people go on Dr. Google and just put themselves on certain diets, but yet they don't know the blood type? That's very important. You have 4 blood types, A, B, AB, and O. A great example is a lot of people, they put themselves by default on vegetarian diets, and that may not be the most optimal. So that's the reason why we test for the blood type here at Aurora Functional Health. I know a lot of you may know this already, but unhealthy insulin spikes lead to obesity. Every time we eat food, it is either a healthy insulin spike or an unhealthy insulin spike. And so the goal is to find the exact foods as well as superfoods so that we can get a healthy insulin spike, so that we will not be subject to elevated glucose in the blood, elevated blood pressure. Did you know these unhealthy insulin spikes also increase our cortisol levels, stress? It also increases our visceral fat. Can you guys hold your tummy right here? If you're wondering what visceral fat is, this is what this is. Okay, it is this quadrant here that I call it the stubborn belly fat. Okay, and again, those test measures we run helps reduce that visceral fat. So eating foods low on the glycemic index helps foster weight loss. For example, anything with the term airy on the end, strawberries, blueberries, cherries, raspberries. Just think of them like that, airy. Okay, our insulin spikes every time we eat, okay, so we know that. Now, a lot of the grain that we're eating is actually highest on the glycemic index. And we'll talk about that later on in the presentation. Okay. Understanding weight loss. Okay. A lot of people say that I need to lose this weight. I need to lose this weight and burn this fat so fast. I gotta go to Cancun. I gotta go on a trip. I need to, get sexy for my date. But a lot of people want to do this extremely fast overnight. And so if we understand how this works, we'll get that a little bit faster. So excess sugars store as fat, okay? And these excess sugars accumulate in the abdomen, the thighs, and the arms, okay? We look at that illustration that I just said when we say we need to go to Cancun and burn that fat. We don't burn fat, okay? We shrink. The fat cells shrink. The fatty reserves are stored in the fat cells. So they're either growing or contracting, respectively, okay? And optimizing our digestion will help shrink those fatty reserves. Reducing our caloric intake, being in a caloric deficit. I firmly believe when you are losing weight, you should get a nutritional deficiency test so you won't have nutritional deficiencies as you're detoxing and losing weight. Now, I know a lot of people that lose weight, but yet they're working out, doing a weight lift program. Muscle weighs more than fat. So sometimes you may see that scale go up a little bit before you see the scale come down because, again, if you put it on healthy muscle tissue, you'll see that result reflected. Now, for my 12 years of clinical experience, we want to look at it from a lifestyle, realistic measure. Weight loss is a struggle. If it wasn't a struggle, we'll all be in size 6 or 7, But lack of support is one of the reasons why we lose weight. For example, finding the struggle. But for example, when we are the only ones in the house trying to make healthy choices, you got everybody else eating the pizzas and the hot dogs and French fries, but yeah, we are the only ones eating salad. That can be depressing. That can be a lonely space to be in. So it's always good to have a support system when you're losing weight. Okay, now, poor digestion, leaky gut dysbiosis. Majority of the cases that I've seen over these course of 12 years comes from leaky gut dysbiosis. If you don't know what that is malabsorption in the small intestine. What an example of leaky gut looks like in the human system is, these are microvilli. And what the gluten does over time, it eats at the microvilli, making them look like monkey paws. Now, when your microvilli looks like monkey paws, you have disrupted your metabolism and your body's distribution system to help you lose weight. So we have to put you on the right program to resolve that nutritional deficiency, helping resolve leaky gut dysbiosis first, okay? Unbalanced emotions and binge eating. What about when we're sad? We go eat some German chocolate, or we go eat some cheesecake or some cheese fries. We're human. We all have been caught doing that from time to time. So more mindful eating techniques will help us reduce weight. Okay. Not consuming adequate amounts of healthy fats and proteins. The average person that I meet does not know how many carbs or fat or proteins they should be eating. Not enough physical exercise, in which my colleague, Dr. Zubin, he's a doctor of physical therapy, he'll talk about that later on in our presentation. A negative environment. I'm never going to lose that weight. I'm fat. Oh, I'm never going to fit in those size 2 jeans. Those type of negative thoughts will hinder one's weight loss. So we always want to be positive, having positive thoughts and positive affirmations over ourselves. Okay. Not hiring a professional. How many people say, oh, I can do that by myself. I can go on Dr. Google and just achieve this by myself. Yeah, you will achieve it, but yet are you achieving this healthily? Okay. Now, depression, anxiety. Sometimes depression, when we're depressed, a loved one died, a dog died, sometimes we just don't have enough energy to be thinking about weight loss, so we may eat on the go. Okay. hence the term of the presentation. It is not the foods we're eating, it is the missing nutrients, okay? You're like, Dr. Salih, what missing nutrients? 90. No one has ever told you your whole entire life that the human body needs the mighty 90. 90 essential nutrients to effectively lose weight, okay? Not only lose weight, but all your body parts functioning optimally. I'm talking about your brain, your heart, your digestive tract, your bones and joints. It's called the mighty 90. And I'm going to show you that all 90 you need. And when we are missing these 90, we develop degenerative illness. Majority of the lifestyle diseases like high blood pressure, cancer, type 2 diabetes are stemming from nutritional deficiencies. A great example, type 2 diabetes is a chromium deficiency. Breast cancer is a selenium deficiency. Depression, anxiety is an omega-3 deficiency. So in order to lose weight, we need 60 essential minerals, 16 essential vitamins, 12 essential amino acids, and 3 essential fatty acids. Raise your hand if you ever heard that. You've never heard that. You've never heard that. Okay, you say, Robert, what is an essential mineral? For example, when you take your calcium, magnesium, phosphorus, potassium, sodium, I will guarantee a lot of you guys are not getting any of these here. That's a long chain list here. 60 essential vitamins. For example, your vitamin A, your B vitamins must be fine properly. And yes, we test for these things. You need 12 essential amino acids. You say, Dr. Salih, what are amino acids? We have lysine. You ever heard of that? Tyrosine, taurine, arginine. We need all these for weight loss, okay? Fatty acids, getting your omegas, but not just omega-3. We need all the omegas. Omega-3, omega-6, omega-9. EPA, DHA, and ALA. Okay. Now we just slightly tapped into how these mineral and vitamin deficiencies lead to weight gain. Okay, but we'll expand more. Zinc is very beneficial to our cellular health, especially now during the winter months. We need the zinc for our intracellular and intracellular health. Okay, now when we have a zinc mineral deficiency, we will have difficulty controlling weight, sluggish, will be tired, low immune function. Okay, again, we know that omega-3 will cause depression, anxiety, being deficient. B12. You ever see someone that struggles with anxiety or may have panic attacks or disorder? That's because they may need Bs. Once we put those B vitamins in through spectral cell testing, that resolves. The panic attacks go away, the depression, anxiety is, and the mood is balanced. So we say, well, how did this happen? It is accumulation of genetically modified grain due to poor agriculture. It's not the wheat itself. It's not that us doctors discouraging food. It's just the genetic manipulation of what they're doing. If you look at the back of the Mars bars, Snickers, and things like that, all of it's bioengineered. Over the course of the years, this is why we see more cancers. This is why we see more weight loss as a struggle. This is the why. This is the root. Gluten intolerance. Okay?